Hi friends, welcome to nerdsbazaar.com. From today onwards, we will start class on live. Before I used to take class on PowerPoint presentation, but today we will discuss live class. So before starting this class, what you have to do, please take a paper and pen, and whenever I tell you some notes, please take the notes so that you can use these notes for your further studies. We'll discuss about one of the small topic of gastrointestinal system. It is appendicitis. I know all of you know about this appendicitis. Still, we will just brush up some informations about it. What is appendicitis? Appendicitis is inflammation of the appendix, that is appendicitis. Inflammation of the appendix is appendicitis. What is appendix? Appendix means it's a organ or vestigial organ or finger like projection you can see in the cecum. It is attached to the cecum. I think you all of you know about cecum. If you don't know, please check what is cecum. Please refer my other videos for the anatomy of intestine. So appendix is located or attached to the cecum. You can see in the ileocecal valve. Near ileocecal valve you can see this cecum, this appendix, and this appendix is attached to the cecum. Normally when you take food, this food go to your stomach, intestine and rectum, etc. So when the food goes through your intestine, it will go, these food particles will enter into appendix and it will go out. But those who are not having a regular defecation pattern or not going toilet regularly, especially children, they will have constipation. So what will happen in this appendix, this fecalith will go and it will obstruct or occlude your appendix. Fecalith means hardened mass stool is called as fecalith. So those children who, mainly children who do not have a normal pattern of going toilet, they have constipation and they will have fecalith, hardened mass stool. This hardened mass stool will go into your appendix, and what will happen, this appendix will get obstructed, sometime kinked or occluded, kinked or occluded. So now what happen, your appendix get kinked, obstructed or occluded. So from this point the inflammation or infection started. Later what will happen, in this area the pressure will increase. Once your appendix get occluded, the pressure inside this area will increase. Then it will cause, once pressure increase, then there will be edematous. It will cause edema. Edematous will be there. Then inflammation will start. Okay, so I told you what is happening. First this appendix get obstructed or occluded. Then because of mainly fecalith, then what will happen, the food particle, the hardened mass stool will cause increased pressure inside there. So then there will be formation of edema, then inflammation. This is what is happening in the pathophysiology. When it comes to clinical feature, normally patient will have low grade fever, then nausea, vomiting, then abdominal pain, sometimes vague umbilical pain. So in some patients you can see pain on umbilicus, periumbilical pain, umbilical pain, and in some patient or most of the patient will have the rebound tenderness on McBurney's point. Rebound tenderness on McBurney's point means, you know where is McBurney's point? McBurney's point is located between your umbilicus on the right side of the, I'm telling the right side, between your umbilicus and anterior iliac spine. If you draw a line between your umbilicus and anterior iliac spine, between or 2/3 of this line you can see McBurney's point. Remember, McBurney's point is situated between umbilicus and anterior iliac spine. So in this point, in the right side, in this point, when you press and when you relieve or when you take out your hand, patient will feel pain, that is rebound tenderness. Okay, so rebound tenderness on McBurney's point is one of the main important symptom. Second is rousing signs. ROVSIGNS, rowing sign. Rowing sign means when you press when you press on the left side of the lower quadrant of abdomen. When you press on the left side of the lower quadrant, patient will feel pain on the right area. Okay, so when you press on the left side of the abdomen, the patient will have pain on the right side. This is the second sign. So Rousing signs and Magbaney signs, then abdominal pain, vomiting, nausea, low grade fever. All these are some of the signs and symptoms. Sometimes patient will have constipation also. Remember, if the patient is having constipation, do not give laxative for those patients. If the patient is having appendicitis and the patient is having constipation, then do not give laxative. Some people will give laxative. So what will happen? This will cause a rupture of this appendix, which will lead to peritonitis. So do not give laxative for the patients. Okay, then come to the management. Antibiotic, analgesics, IV fluid, these are the management, but the best and the proper management is surgical management, that is appendicectomy. Appendicectomy means surgical removal of the appendix. Surgical removal of the appendix is called appendicectomy, because if you remove this appendix, it will not cause any problem for the patient, because appendix is a vestigial organ, which means if there is no use with appendix. Nobody found the function of appendix. If appendix is there, if it is not there, nothing will happen to human body, so you can remove it. So better to remove it. So that is appendicectomy is the surgical management. So 3-4 points we learned, that is what is appendix, what is appendicitis, then main features, especially Magbaney's point pain, then Rowan sign. Then if patient is having constipation, do not give laxative. Then the surgical management, also the pathophysiology. In the nursing management, it's simple. We will care patient, there will be pain management, then we will give some health educations to the patient, then IV fluid, the fluid balance. You have to correct the fluid balance of the patient, because patient will have lot of dehydration. So these are some of the nursing management. I hope that you enjoyed this video. For to get other my videos, please subscribe my channel, also like it, and try to share it, so that other people also will get this video. For online, we are giving online coaching through WhatsApp. So if you and or some of your friends want to join, tell them to message me on my WhatsApp number 00971522206. I'll repeat, 009715222069493. This is my number, or you can contact in www.nursebazaar.com. Thank you.